future. Okay, so I'm really happy to introduce China. It sounds like a lot of you are already big fans of her amazing work, and will know that she leads the Deaths by Welfare Project at Healing Justice London, researching welfare state violence alongside those most impacted. She's committed to research practice that cultivates and restores dignity, belonging, safety, and that is abolitionist, in community with those harmed by state violence. She's published widely on state and corporate violence, structural oppression, suicide, and mental health, and is the author of Decolonising Global Mental Health, published by Routledge. She's also a member of the Poverty, Power, and Stigma design team at the Joseph Rowntree Foundation, working alongside people with lived experience of poverty. So really happy to pass over to you, China.
Thank you so much, and let me see if I can share my screen. Is that working?
Yeah, we can see that.
Brilliant. I have a fear of you being able to see how many tabs I've got open, but hopefully you can't. Thank you so much for inviting me to share some of this work, Hill. I really appreciate it, and have been around and with and in various Medact spaces over the last kind of year or two, which I've just been so grateful for and always found them to be so brilliant. So yeah, really looking forward to the session today. So yeah, I work, just as a bit of context, I have, as of October, left academia entirely, which I'm extremely excited about, but I'll try and contain myself, and now work 4 days a week with Healing Justice London. I'll talk a little bit about throughout this. And as part of that work, I'm head of research there and also lead the Deaths by Welfare project. And I was conscious that maybe some of you might already know about this work, like Mike. I'm very touched by what you said. Thank you so much. And others might be new to it. So I've tried to sort of balance that, but I'm sorry if it's a bit repetitive for some of you who might know it. And I've tried to kind of focus on the sort of research tensions and dilemmas, I guess, that come up in this work for this space particularly. So as a bit of an introduction, I normally kind of give a sort of content warning, I guess, about the work, or a content note. And I thought it's actually kind of important to talk you through that's been a big part of the research and of the work in and of itself, because it's about such a harrowing and like visceral lived reality for so many people about benefits and about what we're kind of calling welfare state violence, that we were really conscious about learning to talk about it so that we weren't in ways that we weren't actually reproducing the brutalities of the system. And that learning is kind of part of our research process, I guess, and something that I'm very happy to hear critiques of or suggestions for doing differently. We wanted to find ways of sharing the evidence and talking about the harm and also about people's deaths, because the project does focus on that, but without it being incredibly triggering, but also not infantilizing people. And so holding attention there about kind of prioritizing care, but also being able to really kind of speak about a brutal system, I suppose. And questions have come for us around that for different work that we've done, like who's the audience. And I think there can be real temptation sometimes to kind of use shock tactics, because there are such horrendous sort of shocking stories to tell, but also holding that, you know, so much of this work is with people with lived experience who know the violence of this system on an everyday basis. And so there's a real kind of issue with shocking people in that sort of sense. And one of the ways that we've sort of always insisted on understanding people's deaths and harms, and particularly if we're talking about people's suicides, is by talking about them in the context of injustice and harm in which they take place. So context is really important to that work. And that being said, I will very, very briefly talk you through our timeline, and you will see a couple of names of people who have died, but I won't be going into any details about people's deaths, and certainly not any details around suicide in the talk now. But as Hill said at the beginning, please prioritise care and honour care in terms of how you engage today with this. And I think an important part of our work for us has been really thinking about what are some of the key messages then that we want to sort of start off with and also leave people with. And that's a kind of speaking back to the dehumanization of people who claim welfare, and perhaps as a part of that, especially disabled folks who claim welfare. And our kind of resistance to that, or that speaking back, I think comes in some of our key messages, which are that no one is a burden, and that we're not a burden to each other, that no one should be defined by their relationship to work, and that our dignity and worth are non-negotiable. And that seems to speak directly to the ways that we are bombarded with the opposite of those things, right, in the media and from the government, etc. And so our work with deaths by welfare is to broadly, and in lots of different ways, investigate the links between the UK welfare social security system and people's deaths, including people's suicides, by centering and learning from the expertise of the folks who are most impacted by welfare state violence, and especially with disabled people and bereaved families so far in our work. That's who's kind of been at the centre of the work. And so, as Hill mentioned, as a kind of core part of this project has been co-creating a timeline of evidence. And I would say, I'll come back to this kind of tension around evidence, but this is sort of evidence on people's own terms, I guess. And I've co-created that with John Pring, who's the editor of Disability News Service, with essential input from Ellen Clifford at DPAC, Disabled People Against Cuts, and Dolly Sen, who's an artist and activist and mad troublemaker, and Rick Burgess, who's done loads and loads of things, but is co-founder of the WOW petition and various other things. And also along with Nick Dilworth, who had learned experience as a welfare rights expert. And so we kind of came up with this timeline that was based on years of particularly John's research, over a decade of research and activism and investigative work around welfare reform, and quite a few years of my own research. We put together a timeline that I'll show you in a minute, that dated from about the 70s up to 2022, and was massive, spanned over 350 pages. And then we shared that with some of the folks who gave us essential input, like Ellen, Dolly, Rick and Nick. And then we made a first draft of that document available online as a sort of public consultation. We received quite a lot of feedback, especially from disabled people. And then working with Access Power Visibility Collective, who are a design collective who really embed access into the actual design of tech and of websites, rather than like doing it afterwards as an afterthought or retrofitting. We created an accessible website, which I'll show you now, give me a second, which we've designed as a sort of tool, as a disability justice tool, I guess you could describe it. Now you can maybe see how many tabs I've got open, but this is the Deaths by Welfare website, which is at www.deathsbywelfare.org if you want to visit it. And there's a whole load of accessibility functions as part of the website. So for example, you can access different kinds of colour contrasts, it will read it aloud, etc., etc. There's lots of different ways of accessing it. And also, I think one of the really important things around access that we wanted to think about was around how distressing this is, how the content of this. So it's actually possible to filter the website in ways which would allow you to search for specific things if that's what you're interested in, but would also give you a kind of content warning before certain entries, say around people's deaths, or for particular sort of key words, I suppose, around kind of suicide or around dehumanizing narratives from the government, etc. And we've got a kind of easy read introduction that starts off the timeline, which says that our motto is that every person's name is written on our hearts and minds, and that we've really tried to both remember those who have died while also holding the kind of scale of harm, I suppose, at the same time. And then if I skip that, I can just show you very briefly. The timeline basically goes from 1942 up to 2022, and is organized by a number of different like tags almost that allow you to search for different things going back kind of in all of that time. And you can see it in a number of different kind of views, I suppose. And we felt it was important to go back before like welfare reform of sort of 2007, 2008, because we wanted to know what like laid the context and the foundations for the reforms and changes that then came in that time, because this harm and the kind of the form of state violence that comes through the welfare state, we felt didn't begin then, so we wanted to sort of give that context, I suppose, and also show that this isn't party political always, like let me find this thing. Sorry, there are this spans a lot of political parties, right? A lot of the harmful policies were introduced by New Labour, for example. So, let me. And now you can hopefully just see. I'll move back to the PowerPoint. And so, why make a timeline? A lot of this came from both me and John's involvement in disabled people's anti-austerity activism and anti-kind of welfare reform activism. I'd heard a lot of people say that they wanted some form of timeline of evidence. So it was very much rooted in that activism and in that kind of movement work, I suppose, and then was co-created obviously with disabled people. And we wanted to piece together a sort of chronology of evidence that looked at and found all the different ways that welfare reform linked especially to people's deaths, which is something that the Department for Work and Pensions has always denied, and have got a kind of whole series of tactics in terms of denying accountability for. I don't know why this keeps flicking. Sorry, it's quite annoying, isn't it? And so what we've done on the timeline is basically bring together a whole load of responses to freedom of information requests, internal documents from the Department for Work and Pensions, loads and loads of evidence that comes from disabled people and from disabled people's activism, and brought all those documents together so that you can access them all in one place online and use that evidence for movement if that's what people want to use it for, or research, or as just different forms of evidence. And I suppose what we also felt it does and really like brings home in doing it, when you look, particularly when you engage with the timeline, is that it enables you to sort of track the delayed but deadly impacts of the welfare state and welfare policy. And so that's something that we've been thinking of as like the slow violence of welfare policy. So where a policy change or a new practice might be introduced and you don't actually start to see some of the really harmful effects, or the ways that policy kills people, until sometimes years later. And it's that slowness, that delay, which the government can very much like weaponize to deny any accountability. And we wanted to try and use a timeline as a tool to really represent that slow violence, I suppose. And so you can use the timeline, like I said, in different ways. You can use it as a search as here, to look at the number of people's deaths, and this is only the people's deaths that we know about, which are a tiny fraction of the number of people who have been impacted and who have died. And here we see, just over the course of like a month, in August 2013, there were at least 3 people's deaths that have been shown to be linked to welfare policy. Sometimes that's because coroners have actually named practices like the work capability assessment, for example, as a trigger in people's deaths. And other times it's because people have left suicide notes, or that name the government as being responsible, or have been, that have been found nearby, surrounded by letters, for example, from the Department for Work and Pensions. So people are like pointing to the evidence themselves, I guess. And I think another really important thing that the timeline does is that it really shows the incredible unrelenting and creative resistance, particularly of disabled people, to make public the links between welfare reform and people's deaths, and a sort of the violence of austerity more broadly. And so what it allows you to do is to kind of look at the context that's happening. So here we see kind of 2010, Ian Duncan Smith suggesting disabled people are to blame for cuts to disability allowance. Budget revealing plans to slash spending. This is very sort of similar to what's happening now in lots of ways. And you can also see just the formation of some of the organisations and disabled people's led groups that will become so central in the following years, to resisting this kind of violence, like the formation of Black activists rising against cuts, Black Triangle campaign, Mental Health Resistance Network, Mad Pride, and the launch of Disabled People Against Cuts. So the timeline is also like bursting with that resistance, and I think it's really important. As I said, so the timeline also is full of instances, like I said, from coroners, from people themselves, where they show the links between welfare policy and harms and deaths. But it also is really quite spooky in that there's loads of documents that show almost like prophecies of early warnings of the harm that's going to come. So from disabled people and also from the Department for Work and Pensions itself. So often in like really banal, innocuous sounding documents like report number 278, you will find clues that point to the fact that these policies, if they're introduced or if they're scaled up, are going to lead to people's deaths. And these are sometimes years before we then start to see people's deaths. So it's quite eerie reading those, actually. And so, as part of the key part of the project, I guess, has been centering lived experience of the welfare system, but also holding complexity and tensions in understandings of justice. And that might be justice that's very much like within the state, or it might be justice that's imagining something completely beyond the state and the complete abolition of the Department for Work and Pensions, for example. And one way that we've tried to do that with the project is to take key kind of moments from the timeline, but go into those narratives in more depth with some of the people that have really lived that reality. And so we've got a 5-part podcast series, Deaths by Welfare podcast, which is on the Healing Justice London website. And you can, if you go into that, you can listen to them, but they're all BSL interpreted, and they're also all transcribed, so it doesn't have to be just to listen to. And that's kind of allowed us to delve, I suppose, a bit more into some of the most harmful policies, for example, around work capability assessment or sanctioning, and some of the investigations that the Department for Work and Pensions itself does into people's deaths that have been found to be linked to policy. And just very quickly, I suppose, as part of that, so in our 3rd podcast, we talk with John Pring, which is quite an unusual thing because he doesn't like public speaking. So that was it's worth listening to, and he reflects on the fact that me and John have had a lot of conversations about is this about flaws in the system? Is it mistakes, which is how it's often talked about, or is this actually the design of the system that's harming people? And that we are both moving perhaps more towards the fact that this isn't a mistake, and that the Department for Work and Pensions know about these harms and have known them for a really long time. And similarly, we talked to Rick Burgess in an episode that's about the work capability assessment. And he talks about how he finds it useful to think about this in terms of democide. So not so much killing people, but taking away the necessary elements that somebody needs to survive, and subjecting them to really inhumane conditions that are very, very cumulative. So constant dehumanization and demonization, and doing that repeatedly, particularly to disabled benefits claimants. And his kind of, one of his versions of justice then would be some kind of truth and reconciliation process. And so I suppose one of the things that we've grappled with a lot, attention in the work, is, you know, are these flaws or mistakes, which is what if the Department for Work and Pensions will admit to anything, it's just tiny mistakes? Or are they actually, is this about the design of a system? Like, it's a feature, not a bug. And I think that's important because it directs us a little bit in movement work or activism, in terms of, are we thinking about like tweaks and reforms in this system, or are we thinking about something that needs completely dismantling and kind of creating a new, and really centering lived experience, particularly of disabled people? And I suppose this is my final slide, and I thought I would just summarize some of those tensions in terms of like what that's meant for research, something we might want to come back to and talk about after we've heard from Avi. But yeah, thinking about how we do research that doesn't reproduce kind of violent bureaucracy. Honouring people's expertise through payment is something that we've been able to do, for example, that is much harder to do when I was an academic because of university bureaucracy. So like simple processes for claiming payment for people's expertise, flexibility for folks who claim benefits, so they might want to get paid in a different kind of way. University ethics applications can feel really jarring to the ethos of this sort of work. And a kind of bigger question about like, what are the challenges of representing and evidencing this sort of slow violence, and evidence for whom and on whose terms? Like, I think we're often asked for more and more evidence, and that can be a pretty violent process. There's plenty of evidence, actually. I don't think the lack of evidence is the issue. And also about how research might create spaces to imagine beyond those small reforms and tweaks in systems that harm us, and actually kind of really start to think about very different kinds of more life-affirming systems. And how this kind of work might contribute to and create cross-movement solidarities, like especially thinking about how naming this violence as like welfare state violence can connect folks to experiences of other forms of state violence, for example, within the mental health system, or within policing, that are deeply, deeply connected. Yeah, and I would love to know more about anyone else here's kind of work and expertise in terms of thinking about research that's sort of in the service of movements, I suppose, and activism. I think that's really important. And I can share this PowerPoint with you if it's helpful, but I've just included some links there that might be kind of useful in terms of aftercare and stuff, and my email address. But I'll stop talking now, and thank you so much for listening, and I will pass over to Avi.
Thank you so much, China. That was incredible. I just was making loads of notes as you spoke, because there's loads of stuff I want to hear more about and ask about, and yeah, really looking forward to the discussion afterwards. And it also was making lots of connections to our work that Avi's going to speak about, and to other issues that are going on right now. So yeah, thank you again, and I'll pass to Avi now. Avi, I did ask you for a bio, but you very modestly didn't provide one. But please do introduce yourself and then take it away.
Amazing. Would you be able to share the slides, please, Al?
Yes, absolutely. Let me just pin you as well. Sorry. Can you see that?
Yeah, I think, yeah, that's perfect. All right. Okay, so hello everyone. My name's Avi. My pronouns are she, her. I am currently a medical student at Imperial, and I'm actually integrating at the moment in global health. So I've got a little bit of background there and new things that I'm exploring there. I also have some lived experience with mental illness and have been within secondary mental health services during my life. So that is a bit about me at the moment. I just wanted to talk to you today about the Criminalising Distress project, which is a project I've been involved with in Medact as a researcher, as part of a research team. Now, this project, we kind of wanted to explore policing within mental health care, and maybe more specifically, this model called SIM, so Serenity Integrated Mentoring. Which was launched by NHS England, originally by a police officer, and kind of carried out for quite a long time. Now, we wanted to focus in on that model, but actually we wanted to kind of explore models similar and kind of policing and criminalization of distress in general within mental health. So if we just go to the next slide, please, Hel. That's great. So when we kind of all the research team got together, we identified 4 key areas that we wanted to look into on this topic. We wanted to know where this all came from, so the origins and the evolutions, and kind of tying into kind of the really deep systemic issues that China alluded to earlier as well. Kind of where did this whole, it being a criminalizing act to be mentally unwell or to be experiencing distress, where did that come from? We wanted to look into the impacts, so both to the service users who had been kind of subject to that policing, as well as the police who had to kind of carry that out, and also the health workers that had to maybe stand by and watch that happen, or even help that being carried out themselves, and also the family members who may have also been implicated by that care, basically. We wanted to explore accountability, so that being through the NHS or through the police service, and kind of who's accountable for what's happening or what happened. And we also wanted to explore alternatives, so alternatives to kind of policing within mental health care, and again, similar to things that China alluded to as well. Next slide, please, Hel. Amazing. So as a research team, we decided to split into 3 groups. So we had a literature review team, which did self-explanatory things. We had hundreds of pages of freedom of information requests that we filtered through. That was a separate team who did that. And actually, I was part of the interview team, which was the 3rd team. So we created topic guides to guide semi-structured interviews with our 3 different groups of people. So we had our service users, we had health workers, and we had other stakeholders. So that might include police or policymakers and people like that who we interviewed. And then obviously what comes after interviewing, so like transcription and analyzing and all that kind of stuff that follows as part of a research model. If we go to the next slide. So as I kind of alluded to, this is a very sensitive thing for a lot of people, especially for the service users who might have kind of been subject to it. So there were lots of ethical considerations through this process. So we first gained ethics approval from the University of Greenwich, and actually China was on our ethics advisory committee as well, which was really helpful as well. And also, I worked quite closely with Hill, and also other members of the research team worked quite closely with Hill to ensure that additional measures were taken with exploring service users' involvement or care or not care within the system. This really risks re-traumatization. So we kind of created personalized safety matrices, is that a word? I think so. In order to kind of ensure that that didn't happen and to kind of contribute to as ethical research as possible. So yeah, that was a huge consideration for us. Amazing. So I've just done a few slides on our preliminary, I can't say the word, findings so far. And I've split that into those same 4 categories that I mentioned earlier. And I won't go through everything, but essentially from our interviews, so from all of our semi-structured interviews, we've managed to pull out some key themes within each of those 4 areas. And so neoliberalism being kind of the first one, with a lot of information under there. Criminalization as well. So again, alluding to a lot of what China was talking about. So the social context of criminality, poverty, homelessness, deprivation, and also that key concept of, state violence as well, and coercion through criminal justice. So we another theme cropped up to do with violence within mental health, and that being key origin of this whole situation, how SIM and other practices came about, and kind of that normalization of being punitive, or police treating mentally ill people in a punitive way, or people experiencing poor mental health. This specific diagnosis, so borderline personality disorder, also known as emotionally unstable personality disorder, was a massive kind of element that came up within our interviews. And this was a diagnosis that was highly disputed by a lot of our service users who were given it, that we interviewed. And as hopefully a lot of you are aware, this is a very stigmatized diagnosis, and it's often very gendered as well, mostly skewed towards females or people that were assigned female at birth. So in terms of who was most impacted, as I kind of alluded to, so women and people who are assigned female at birth, as well as this diagnosis. So there's BPD/EUPD diagnosis. People who had survived trauma as well. So that ranges from a whole host of different traumas, and that kind of ties into this diagnosis of BPD as well. But also tying into that is the undiagnosed autism. So a lot of those people that were under SIM and SIM-like practices were then later diagnosed with autism, or maybe even suspected to have autism now. And so it's very interesting, this kind of pathway of trauma to then assumed diagnosis of BPD to then, actually this deeper neurodiversity going on as well. So in terms of the impact of police involvement, obviously we didn't find great things about that. So people found it traumatic or re-traumatizing, but actually it highlighted a deeper problem as well of mental health care being traumatic kind of regardless. And sometimes actually the police involvement, sometimes those individuals, that individual police person might have treated them better than the mental health professional that they saw prior to that. So actually that was quite interesting as well. So while the police largely weren't kind of a good involvement in the mental health care, it was interesting to see that maybe the mental health professionals themselves weren't much better, or at least those that had experienced that. So so just some feelings as well. So people felt intimidating, embarrassed, confused, and shamed. And obviously that is not what we want within mental health care. Okay, so in terms of accountability, all 3 of these organisations took very little to none accountability. So NHS England actually revoked this whole model. So after saying, yes, we totally back SIM being implemented, they then revoked it with very little to no apology and no accountability, basically. Police, the same story. They just kind of went along with it. No one really said anything. And also the Academic Health Science Network. So across the board, we found little to no accountability, answering our question of, how can no one say anything if all this harm was caused, all these people's lives were changed by this, and for what? Who's now to answer to? And the answer is nobody, which is really sad. So as well, we have evidence ongoing harm. So there are still schemes that exist to reduce the demand of high intensity users. So this is a phrase that they use to justify SIM. So a high intensity user was normally defined by someone who attended A&E, for example, 9 or 10 times in a row for mental health concerns. So whether that be self-harm or suicide ideation, something like that. So then they were branded this name, high intensity user. And I guess we've seen that actually there is ongoing schemes that, despite NHS England saying, no, actually, we revoke SIM and we think that's a bad thing, people are kind of interventions are still, and innovations are still existing, and being promoted and being rolled out kind of under a different name, but with the same principles and the same ideas, which is really worrying, actually. And as most of us are probably aware, police are still very much involved in mental health care. And and also data is being shared. And this was a big thing that came up, actually, in terms of data sharing, confidentiality, people's concerns around that, and those concerns not being truly addressed. It's kind of a given within healthcare that data is kind of shared within your same hospital admission, like medical notes, etc., are all kind of shared about. But then that same level of detail and that same data being able to shared with police officers as well was quite questionable and quite a breach of confidentiality, and oftentimes without consent of the individual either. Okay, so in terms of alternatives, so we kind of asked everybody that we interviewed, like blue skies thinking, like what do you think would be like a perfect system or a better system anyway? And the bottom line is there's no single best approach, basically, but lots of possibilities were highlighted. So many people highlighted kind of patient-centered or person-centered care, and also cops out of care. So police no longer being involved in mental health care, not just like punitively or not just in sim models, but like in general, no more cops in care. They also highlighted a need for informal networks of support, so voluntary sector support, kind of peer mentoring, that kind of stuff was highlighted a lot too. But also this kind of transformation needed, basically. And Hill's put this little model here, which I actually don't know about. Hill, can you talk about this model a little bit?
Sorry, Avi. Yeah, well, I'm not an expert either, but some of our interviewees spoke about it as a really inspirational alternative, and perhaps there are people here who know more about it than me as well. But the Tress model, as far as I understand it, and it's mentioned in Misha Fraser-Carroll's work, and as well as a region in the north of Italy where they have a radically different approach to people in mental distress. Based on these 4 principles: that everyone deserves dignity and respect, that there is therapeutic value in inclusion, and that community can create a kind of very important inclusive social fabric, and that patients function best when we preserve their freedom, so that basically they've all pretty much abolished kind of like inpatient psychiatric units, is my understanding. I'd love to hear more from other people actually about it, but that's my sorry to shove that in there, Avi, without you.
No, it's okay. It's okay. It all makes complete sense, but I just wasn't familiar. I'm not familiar with the model, so I didn't want to do an injustice. So
no, that's come from the Lit Review team. Yeah.
Oh, amazing. Thank you. I think, is that my final slide?
Yes, that is your final slide.
All right. Well, thank you very much, everybody, for listening. I'll be happy to take questions and discuss further later on.
Thank you so much, Avi. That was absolutely fantastic, especially as, we worked on those slides together really like last minute. And so poor Avi, I just dumped in the last bit without her knowledge. But you absolutely smashed it. So thank you so much, Avi. And I don't have questions for myself about that, but I'm sure the audience members will. And I'd love to hear, I know that Avi and myself and the other members of the Criminalising Distress team here would love to hear your thoughts, China, and the rest of the people in the room's thoughts. So we've now got time for Q&A. So let me just remove the pin and also stop recording so that we can stop recording.